लाल रंग कब मुझे छोड़ेगा.
Gosh, it was that easy. कब मुझे छोड़ेगा बोलने से थोड़ी छूट सकता है. Yes, you guessed it correct. Today we are going to discuss effects of alcohol and how to de-addict alcohol addictions. Hello there, I'm Dr. Purnendu Roy. I'm a surgeon in Genesis Hospital, and today we are going to discuss problems of chronic alcohol consumption. Trying to go through the statistics, how severe is this problem of alcohol consumption? I checked up some Indian statistics. 30% of Indian population are consuming alcohol on a regular basis. 11% of these people are moderate to heavy drinkers, and on an average, an Indian will consume 4.3 liters of alcohol per annum. People who love their drink, they find out some excuses. Like they will say, a little bit of red wine on a regular basis is good for heart. It keeps the coronaries dilated. There are some people who will give excuse about their job. I have seen many of my patients after surgery, they will come and ask that, Dr. Saab, I work in sales department, and in these sales meetings sometimes with the clients you will have to. Then I ask that if you want to drink, why are you looking for excuses? Look, I am a teetotaler, so that's my wish. Now, if you want to drink, then you should know what are the effects of alcohol, and all people who are trying to tell it is good for energy. Now it's cold weather, you need to drink alcohol before you go out, like one for the road before going out. Some people talk about it keeps the heart young. These are all excuses. Let's try and see how alcohol actually damages our body. Let's take different system one by one. First, digestive system. Now, with consuming of alcohol, it can cause irritation and causes sometimes gastritis, gastric ulcers, and this alcohol in the intestine will prevent absorption, digestions, and sometimes lead to chronic alcohol consumption, may lead to malabsorptions and dietary deficiencies. Sometimes it may cause dehydration and cause constipation, irregular bowel habits. Alcohol in the oral cavity and along with tobacco sometimes increases the risk of cancer in the oral cavity, and sometimes also increases the incidence of cancer of the esophagus. Alcohol also gives a feeling of bloating, gaseousness, distension of the abdomen. So it sometimes causes reflux, and the food and alcohol comes up and causes inflammatory changes in the esophagus, which is called esophagitis, and that can give rise to burning sensation, which is called heartburn. The two organs which are affected most by alcohol is liver and pancreas. Why liver? All the toxins that our body consumes, when it is absorbed from the gut through the portal vein, it goes into the liver. Liver is the site where metabolism and degradations takes place. So when we drink alcohol from the stomach through the duodenum, it goes into the intestine, and when it is absorbed through the portal vein, it reaches liver. So it has to be metabolized and excreted out. Now there are three ways that the liver gets affected. Early stage, it's alcoholic fatty liver disease. Another term is used many times, it's called ARLD, alcohol related liver disease. So the early stage, as I said, alcoholic fatty liver disease, here what happens, fat starts accumulating in the liver and we diagnose this as fatty liver. But if in this early stage one reduce or stops alcohol consumption, this is still in the reversible stage. It's the early stage of the liver damage where liver starts storing up fat and increases in size. The second is acute alcoholic hepatitis. Depending upon the consumption and the amount of drinking, hepatitis, when we talk about, what exactly is itis? Itis means inflammation. So when the tissue gets inflamed, liver tissues are, the cells are called hepatocytes. When we talk about appendicitis, most of you are aware of itis. Like when it happens in appendix, it is appendicitis, in colon, colitis, if it is in the conjunctiva, conjunctivitis. In the same way, when it affects the liver cell hepatocytes, it is alcoholic hepatitis. Now in this, the tissue cells are damaged, the liver gets swollen up, and if not controlled with medications and treatment and stopping alcohol consumption, it can give rise to liver failure, and acute alcoholic hepatitis can be a very serious condition. The third stage is alcoholic cirrhosis. Now, once the liver is damaged and you're not taking care of it, then the healing starts by fibrosis. So there is a lot of scarring and the liver becomes nodular, and this is the stage which is not possible to revert back into normal. This is cirrhosis of liver. Now because of the fibrosis, there are many things that happen. We all know that we have heard that many of the so-called film stars, and in olden days many people, they just kill themselves by drinking. Like how does this happen? Once cirrhosis takes place, the veins inside the liver, they get, because of scarring, obstructions, and then portal hypertension, which means increased pressure in these veins, and this causes dilatation of the veins. So in the gastrointestinal system, in the lower part of the esophagus, gastroesophageal junctions, all the veins become so dilated, this is called esophageal varix. On endoscopy, one can actually see that in the lining of the esophagus, the veins are all dilated. There are different grades of it, and sometimes they ruptures and leaks, and the people start vomiting torrential amount of blood, and many people end their life either by blood vomiting or by liver failure. What is important is to be aware and recognize the early symptoms of ARLD, alcohol-related liver disease. Their early stages: nausea, loss of appetite, increased thirst, swelling of the feet, abdominal discomfort. One can develop jaundice, fatigue, sometimes the skin color changes, red hands and feet. One can start having dark or blackish stool, because if there is bleeding inside from the portal hypertension and esophageal varices, then the stool gets mixed with the blood and they come out as black stool, which is called melena. There can be confusional stage, there can be irritability, sometimes there can be fainting attacks, bleeding gums, and in men with long-term consumption of alcohol with liver disease, there can be enlargement of breast, and that's called gynecomastia. That's because the liver actually is also the site for metabolism of hormones, and if production of testosterone becomes less and estrogen takes over, so the female hormone effect starts manifestation in the body. You're at a higher risk of suffering the effects of ARLD, that is alcohol-related liver disease, in case there is a family history of alcoholism, which means that it is accepted as a social norm in your house or family. If your friend circle is such that whenever you meet, you just need an excuse to start drinking. In case if you are a binge drinker, like there are occasions when you're drinking so heavily, you're just losing all control. Sometimes if you get into the habit of drinking alone in the night or in the evenings, every day on a regular basis, or if you actually start drinking in daytime, and if alcohol is affecting your normal day-to-day activity, that means this is a problem. And once you can recognize it is a problem and you accept that it is not you who is drinking alcohol, you are actually drowning yourself in alcohol, and that is the time to start taking action. So the first what we need to do is to establish the diagnosis that this is an alcohol-related liver disease. So the blood test that we do is we do a complete blood count. We do a liver function test. In liver function test, it indicates the liver enzymes, SGOT, SGPT, alkaline phosphatase, and also it gives us an indication of the protein level, total protein and albumin globulin. It gives us an idea about the bilirubin, whether the liver, how severely it is damaged. We should do an ultrasound scan of the abdomen to check the liver, and maybe a CT scan of the abdomen, and sometimes we need to do a liver biopsy, and that is to show how severe it is. So how do we treat once we have established that it is ARLD, alcohol-related liver disease? First is obviously to stop alcohol. Now this may not be as easy as it sounds like. There are people who have given up drinking many times because they have started it again. It's like giving up smoking, so it needs professional help. So there are institutes where de-addiction and rehabilitation procedures are followed in a professional way. There's no point going into that detail. Now, addresses for such alcohol de-addiction centers are easily available wherever place that you are staying or by searching in the internet. Treatment sometimes can be symptomatic. There can be vitamin supplement, proper diet. Sometimes the effects of liver disease, which means portal hypertension, esophageal varices, they need treatment. So, and that is endoscopic injection sclerotherapy into these veins, or staplings in these areas where these veins are clipped endoscopically, so that there is no future chance of having torrential blood vomiting. Early stages, it can still be managed like this, but if it is an advanced liver disease with cirrhosis, then the only treatment is liver transplant, and there is nothing else that can be done. The other important organ that gets affected is the pancreas. Alcoholic pancreatitis. We know that there are two things that affects the pancreas the most. One is gallstone pancreatitis, and the other is alcoholic pancreatitis. Alcohol induces release of pancreatic enzymes, and they sometimes can cause inflammation, just like I said that itis is always inflammations. Hepatitis was alcoholic hepatitis, like appendicitis, conjunctivitis. So when it affects pancreas, it's called alcoholic pancreatitis. It causes severe amount of pain in the upper abdomen. The pain actually goes back and the person can crouch like this in pain. Alcoholic pancreatitis can be acute pancreatitis, which sometimes can be very serious condition. And repeated attacks of acute pancreatitis can give rise to chronic pancreatitis. Just like in liver, I said that it causes fibrosis. It can cause fibrosis in the pancreatic tissue and cause scarring. And these causes obstruction in the pancreatic duct systems, and they actually get dilated, and the minerals, in case it gets deposited in the pancreatic juice inside the duct, causes pancreatic duct stones, and that can give rise to severe amount of pain at times. Treatment of pancreatitis is just by symptomatically. You cannot allow the patient to eat or drink. They are on intravenous fluids. We give usually antibiotics and nutrition supplements in the form of total parenteral nutrition. And it is established by actually seeing the blood levels of amylase and lipase. This is an indicator that the pancreas is inflamed. We also do ultrasonogram of the abdomen to see the condition of the pancreas. A CT scan gives rise to much better delineations of the pancreatic structure. The next system that I'm going to discuss is central nervous system. The most of the accurate work starts getting disturbed. First thing to get affected will be communication. Slurred speech starts. Like after the effect of alcohol, we all know that if I had a glass of drink now and then I try to start talking, my speech will be completely slurred, right? What is important also about coordination movements? Finer movement starts getting affected. Balance gets disturbed. The normal walk or the gait, that is not straight. A person tends to sort of waddle around into different directions. This is the time when you are not supposed to drive because your judgment is also affected. You cannot do finer works. Emotional effects can take place. Sometimes long-term memory, short-term memory can get affected. Judgment and other decision making can get affected in this, and the frontal lobe sometimes in long term get affected, which is for the higher functions. And prolonged use of alcohol can cause actually permanent brain damage, and they are also, there is a syndrome which is known as Wernicke-Korsakoff syndrome, which affects the memory function of the brain. Talking about the circulatory system, it causes increased blood pressure, heart rate, irregularities of the heart rate, and the people who are the drinkers have a higher chance of developing heart diseases like heart attack, stroke, and other diseases, and even heart failure. Their ability to pump the blood out of the heart is also less. Talking about sexual and reproductive function, many people have this feel that alcohol actually may improve the sexual function, but that's completely a myth, because what it is written in a nice way, that it increases the desire but reduces the performance. Alcohol can cause decreased amount of libido. For men, it can cause erectile dysfunction and difficulty in getting a proper erection, and the performance also is affected. Among women who are chronically drinking, their fertility chances are lower because it causes hormonal imbalances. Women who drink during pregnancy has also some very bad effects like F.A.I.S, fetal alcohol syndrome disorder. It gives rise to certain learning disability, emotional disturbance, certain developmental abnormalities. So it's definite that while a lady is pregnant, should not consume alcohol. So once a person is drinking on a regular basis without realizing that it is harming the body, gradually they become alcohol dependent. And at that time, while stopping alcohol may give rise to again a condition called withdrawal syndrome. The withdrawal symptoms can include anxiety, restlessness, irritability, tremors. There can be high blood pressure, irregular heart rate, excessive sweating. Sometimes there can be hallucinations. Sometimes the persons can have seizures, convulsions. Now, once all these things start, they require professional help. So, after discussing all this, one thing which we have done, we couldn't find anything that it does good to the body. It can't be that it keeps the heart young, the body young, or any increase in performance in sexual activity. It actually harms each and every organ. So why do we continue on this? Now the answer from the people who drink, they say,
जो न पिए वो क्या जाने, पीते हैं क्यों हम दीवाने
no, it's just an excuse. So please, let's take a pledge that we will not harm our body, and let's also take a pledge, people who are getting affected with the effects of alcohol and need help, we will spread this awareness among our friends and relatives. So please like this video, share it with your friends, subscribe to my channel so that you can keep getting such informations on health and diseases at a regular basis. Thank you very much for watching.